Hi, I'm Cindy White. I'm here today in two roles. One is my role with the Rutland Recreation and Parks Department, and the other is on the advisory committee for the Rutland Area Physical Activity Coalition. And so you are watching Planet Raypack, and today we're not out on the trails or in the field promoting any great physical activity that's currently happening right this moment. But we're here today to talk about a grant that Raypack received, the Rutland Area Physical Activity Coalition received, that's about making Rutland a healthier place for people to live, work, and play. We have some great guests today who came up from Florida, and being fall foliage time of year, we took them out to see some beautiful colors in Pine Hill Park, and we'll be doing a walking tour of Rutland as part of their visit. But today, again, we're going to focus on what this grant is that was received. It is a federal grant that Rutland was one of 10 communities in 2010 to have been chosen out of 94 applicants. And again, this is a program about making Rutland a great place for everybody to want to live in, to work in, and play in. So we're going to jump right into our guests today and welcome them to Vermont, and especially to Rutland. And they're going to tell us about this Achieve grant, what it is nationally, what it is happening in different states, and then we will also talk about what we're going to be doing in Rutland. So first, I'd like to welcome our guests. Thank you so much. We've got Jenny and Allie with us today. If you guys can introduce yourself, tell us, who you are, where you came from, and then we'll jump right in after that to what this grant was all about.
Great, thank you. First of all, I want to thank you for having us. We're very excited to be here. I speak for both Allie and myself that getting out and visiting the communities is probably the favorite part of our job that we get to do with Achieve. But I am the project director for the National Association of Chronic Disease Directors that's based out of Atlanta, Georgia. And we actually work all over the nation with communities, 43 other communities, just like yourselves.
So you do a lot of traveling.
We do.
We hope this will be one of your favorite stops in your journey, but I know I'm looking forward to getting to Atlanta at some point soon. Why don't you go ahead, Allie, and introduce yourself?
Yeah, and again, thank you for having us. This is my first time in Vermont, and I think Jenny's as well, and it's really been a great trip so far, and we hear we're having great weather, so we're definitely enjoying the weather, and really looking forward to getting out into the community today, doing a walking tour, getting to see some of the sites, because that's really what we do as part of my role with Achieve. I'm a consultant on the project. I work closely with Jenny and provide technical assistance to some of the communities that we're funding, and this is part of the technical assistance we provide, actually coming to the community, doing a site visit and getting out and kind of walking and getting the experience of what it's like to be a resident here. So we're really looking forward to it.
Great, well, thanks for coming. So if you guys can take some time and explain to everybody what Achieve is. I mean, I know it stands for something. I never remember what all those letters stand for. Maybe where the money comes from, what the intent is, kind of that broad vision of why the CDC is looking to go this route for getting our country healthier and off the obesity path.
Okay, well, I can start. Achieve is actually a fairly long acronym, and we have many of them in the Achieve program, as you've noticed. But Achieve stands for Action Communities for Health, Innovation, and Environmental Change. And it doesn't actually go with every first letter, so it is really creative. But it was, we thought, a really positive word if you wanted to describe something in just one word, that Achieve is all about helping communities achieve their potential to be healthier places to live, work, and play. And so that's the kind of the definition of what Achieve is. But the reason Achieve was initiated to begin with, and I'll talk a little bit about the history in a minute, but there's a growing trend of obesity in the United States, as you've stated. We have increasing rates of heart disease, increasing rates of diabetes in this country, stroke, some cancers, all of which are impacted by people not being physically active enough, not eating healthy, smoking, and some other behaviors that are really leading us to this expanding burden of chronic disease, and it's also creating an economic burden on communities, as it is on our nation, and it's creating a burden on families as well. So it's not just a single problem that we have, it's really systemic. And so in looking at what can be done in communities and helping communities take responsibility, this project was created in 2007 to try to take a look at, could a national partnership, because we have national partners, but could a national partnership technical assistance program help communities really begin to help themselves and to look at with fresh eyes what's going on in their community, what the potential is for creating a healthier community, and getting community involvement to really take ownership of creating what you all want for your community. So just to give a little history, Achieve was started in 2007 with some mini grants, and we initially kicked off 10 communities in 2008, and we called them our pilot communities because we learned a lot from those communities. It was really a give and take that year. But what we do is we as national partners, provide a lot of technical assistance, as well as some limited funding. We know it's not a lot of money, but it's usually enough to get people to some training programs, some resources into the community, bring a team of people together, because we like our communities to model the community partnership as the same as we have at the national level. And so bringing those resources into the community to really begin the process of thinking about, what do we have in our community? What are our assets? What are our challenges? And what's possible within our town? And so we're not coming in and telling a community, you must do this. We're coming into a community saying, these are the things that are possible. These are the types of programs and policies that we've seen in other communities that have been helpful. And really working through that to help the communities get to where they need to be. So our initial teams in 2008 began this process, and it's a three-year grant process is really what it is. But we are encouraging communities to stick with us longer, and so far our 2008 communities have done that, even though they've kind of cycled off their three-year project period. Because part of what we do is we get communities to think about this long term, and solving health problems at the local level is not just a 3-year initiative. We know it really has to be something that the community members look at for the long term. But every year since then, we have funded 10 communities. In 2009, we had some additional national partners join us. So I talked about this national collaboration partnership. And we, National Association of Chronic Disease Directors, are funded by the Centers for Disease Control and Prevention. And initially, our first partner was the YMCA of the USA. And together, we funded these first 10 teams. And we really recognized that the national partnership, when it was shared at the local level, really created the synergy and this much more expansive approach than what one organization can do in the community. And so in 2009, the CDC funded some additional national partners to help us. The two that came were National Association of County and City Health Officials, who typically work with local county health department structures, and then the National Parks and Recreation and Park Association, who again brought other resources. So together, the four of us fund local communities, and there's actually a fifth partner, and they provide technical assistance on a much broader, wider scale to the national partners, and that's the Society of Professional Health Educators. They don't fund local communities, we do. But essentially, all of the partners who fund communities fund 10 communities a year, and we work through the same process together, but we share the resources and we share the skills and in many cases the technical assistance. And we work with our teams to help them create what's called a CHART, Community Health Action Response Team. And the Community Health Action Response Teams are a group of 8 to 12, sometimes more, sometimes a little fewer, people who come together who want to make their community a healthier place to live. Because we know a healthier place to live will mean healthier people working in jobs and strengthening the economy. And so they're working on policies specifically that focus in on reducing tobacco use, improving physical activity, and improving nutrition within the community. And there are a lot of different things that can be done within just those 3 areas, but all of which is intended to begin to reduce the obesity epidemic, and to look at slowing the rates of heart disease and stroke, and really just improving the quality of life for the people who live in communities.
I know, like one example someone gave to me, which I think it was like at our local level, we talked about the policy change. So just, trying to wrap my head around a little bit of like, what does that mean, a policy change? And, we're not necessarily, the hospital's not doing this, so I don't want a general alarm going. But the thought was to explain it to myself to get better understand it, was that the hospital would be much better off if they wanted to make a difference in the lives of their employees, rather than running another Biggest Loser contest as part of worksite wellness, is to get rid of the fry-later and have no fried food offered in the cafeteria. That would be a policy change as compared to, say, running another program. If they wanted to really make a difference in their employees, that was a long-term benefit, is what you're providing in your cafeteria as compared to like another program that's a 3-month program. You see some results at one point, but then it fades away. Is that an accurate, would you say, policy change that someone could make within their work site?
Very definitely. And they're very easy. I mean, some policies to put in place are a little bit more difficult. But usually when you say the word policy to someone, and this is the hardest part in our working with communities, is they always want to put programs in place, because programs,
it's what's familiar. It's what we've been doing for a long time.
People feel like they get something directly. But a program is only there as long as the people are there or the funding is there, and very often those do go away. And so with policies, the reason that Achieve has focused in on policies is because policies are typically, once you get community support around them, they're typically long-lasting. They don't cost as much. Sometimes to implement a policy may cost a little bit, but they don't cost what programs cost to put in place. And policies are all around us. They govern our behavior all day long. Just when we have to go to school, stop signs, walking on sidewalks, all of those are a policy somewhere, whether it's in a city ordinance or you mentioned a worksite wellness policy. There are policies and practices that are put in place to manage our behavior throughout the day for whatever, for work or play. And so these are ways that we can more easily put in place and create a community that people will want to be healthy in. So your example, yes, is an example of an organizational policy that can be put in place. And that will be much longer lasting. Say the dietitian at the hospital were to leave. Well, that policy is still in place, and so those people in the hospital, the patients, are still going to receive better, healthier foods,
and the employees,
and the
visitors,
and the visitors.
Right. And I think with policies, one of the things that we hear from other communities, and some folks have actually adopted this as kind of their slogan, is making the healthy choice the easy choice, so that when the policy is in place, as Jenny mentioned, they're kind of all around us, and you may not even notice that the frying food is no longer available in the hospital, because you're going to eat what's there. And so it's kind of just making it part of our everyday life. The same thing with promoting physical activity and having sidewalks and bike lanes and public transportation that's accessible. Just having those things available and making it part of everyday life makes that healthier choice the easier choice. I mean, it would be great if we got to the point someday where it's easier to walk someplace than get in your car and drive there. And I know here in Vermont with weather, sometimes you have to get indoors and you've got to use transportation, but I mean, I'm sure there's lots of creative ways of getting around outside, even in the face of snow and sleet sometimes. So.
Yeah. Well, it's like, our downtown, and we were, driving around earlier today, was that, one of the things I learned when we went down to that Baltimore trading that we shared earlier was that sense of, how it's great to have our businesses downtown, but like if we went back in time to when the plaza was built, if those buildings were put right up on curbside, and so it was easy to walk to all the various businesses, rather than right now to get into the plaza. It's very easy to take your car there and park and go into the Walmart or go into the TJ Maxx or go into the Price Chopper. But if they had built right up to the edge, it'd be very easy to walk store to store, as compared to now it's a little intimidating to walk downtown and to think about getting across that vast parking lot to get to the store. So it more is towards the car as compared to the pedestrian.
And there are a lot of things that you can do to make downtowns more walkable and more bikeable. As Ali mentioned, we'd like to see a society where there are more opportunities to bike, but unless you've created safe bike paths and bike lanes or safe